Welcome to the Hunt Performance YouTube channel. Make sure you like and subscribe for more videos related to health and human performance. Leading up to an event, there's a short period of tapering, which is sort of a break you give your body to fully recover in preparation. Implications when it comes to tapering as shown in this study I will break down for you today. Acute physiological responses to 4 running sessions performed at different intensity zones is about the changes in your body performance after exercises that are high volume, high intensity, and everything in between. The study was published in 2021 in the International Journal of Sports Medicine and has 4 contributing authors. 4 running intensities, low, moderate, and high, and supramaximal, were done by test subjects to review acute responses to their bodies up to 24 hours post-session. As intensities increase, volumes decrease. The purpose was to compare acute responses from sessions up to 24 hours after different training session intensities. This study tests 24 recreationally trained male runners from ages 20 to 45 years old. Each person did all 4 intensity sessions spanning 1 month and were sampled before, immediately after, and 24 hours post every session. Fatigue is measured by many variables in previous research. Sampled in this study is heart rate variability, countermovement jump, which is essentially jump height, submaximal running test, which tests variables during 2 5-minute stages that are 70% and 80% of their heart rate max. Perceived recovery, tested pre and 24 hours post-session on a 0 to 10 scale. And muscle soreness, also tested pre and 24 hours post-session on a 0 to 10 scale. Heart rate variability decreased after light, moderate, and high supramaximal intensities. Similar to other studies, heart rate variability shows a small decrease in light intensity exercise and decreases even more as intensity goes up. Supramaximal intensity showed a smaller decrease than moderate intensity, which was unexpected despite other variables that showed higher blood lactate and perceived exertion. 24 hours after all sessions, heart rate variability returned back to normal. Countermovement jump decreases after light and supramaximal exercise. 24 hours after the sessions, countermovement jump remained decreased after supramaximal and back to normal for the others. Light takes the longest time to complete, and supramaximal is the hardest to complete based on output, which may affect the jump directly after. Supramaximal could have damaged cells and they are in recovery or repair mode 24 hours post the section, whereas others have already recovered. During the run test, heart rate increased after all sessions, then decreased 24 hours post for all sessions. Rate of perceived exertion increased after all sessions, but only returned to normal post 24 hours after light and moderate intensities. Supramaximal and high intensity runs were increased 24 hours post session and showed no difference between them. This means runners felt more exerted 24 hours after the high and super high intensity runs, and the low and moderate runs had no exertion effect the day after. Oxygen consumption increased after light and moderate exercise, while no difference after high and supramaximal. All sessions returned to baseline post 24 hours. Blood lactate was higher after supramaximal exercise than any other session. Perceived recovery was not significantly changed, while muscle soreness increased after light and supramaximal intensities, with no change in other sections. Results show how performance is affected after 4 different training intensities. Broad values measured in this study give you a well-rounded view of how the body recovers after exercise. Recovery seems to be delayed based on the increased intensity values in the previous session. Neuromuscular performance and soreness were noted after the most intense and highest volume training in the study. 24 hours post the session, cardiovascular and metabolic systems seemed to recover fully after all sessions, showing they might be the first to fully recover. This study can broaden the knowledge on how to train leading up to events, as it gives you a well-rounded glimpse of what happens in the body after 4 types of running sessions. Based on the study, tapering, especially in the few days before an event, should be limited to moderate exercises, as the intensity or volume does not show much of a lasting effect on the body. These exercises delay muscle building and repair, which you do not want immediately prior to a race day. Of course, this is not the only study that has researched this. I suggest getting familiar with other research similar to this for a well-rounded approach to implement during your workouts. Thanks for checking out this hump performance video. Hopefully you use this knowledge to perform better from here on out. If you do, make sure you like and subscribe for more.